Hello, and thank you for joining us for this special edition of State of Texas. I'm Josh Hinkle, and today I join you from the grounds of the state capitol. Amid the spread of COVID-19, earlier this week, Governor Greg Abbott released a series of executive orders right here aimed at slowing the spread of the virus. Maggie Glenn shows us how one order put new restrictions on some people traveling to Texas.
Those entering the state of Texas through an airport, either in New York, New Jersey, or Connecticut, will be subject to a mandatory self-quarantine for 14 days or for the duration of their stay in Texas, whichever is shorter.
This order also applies to the city of New Orleans. DPS will take the lead in enforcing this. Travelers will fill out a form, and DPS will keep tabs on you, including visiting where you choose to quarantine. Executive orders he issued this week have increased the number of hospital beds available statewide.
Since those executive orders, I'm proud to tell you that in the aftermath of those executive orders, more than 3,000 beds have become available in hospitals across the state of Texas.
While Texans have responded to the call to donate time and resources, Abbott says there is still more to do.
If you want to offer your own medical professional services, or you would like to volunteer, go to www.texas.gov/COVID-19.
The governor says he knows that some Texans want to get back to work and are ready for social distancing to end.
It's important for the world, as well as the United States, that the United States get up and running as quickly as possible. That said, everyone understands that we will all be working off of the best advice of medical professionals.
Maggie Glenn for State of Texas.
Thanks, Maggie. University of Texas researchers are saying we need to limit our in-person interaction with others to just 10% of what we'd normally do. This graphic shows how that could make a big difference. The blue bar on the bottom shows the hospital capacity in the region that includes Travis, Williamson, Bastrop, Caldwell, and Hayes counties. Each of the red lines shows scenarios where the number of patients coming into hospitals outpaces the number of available beds. If we do not social distance at all, hospital capacity will be exceeded by April. If we cut our daily contacts by 90%, then we will not overwhelm our hospital capacity.
We actually can have an impact, right? If we adhere, if we just do our part and try to kind of avoid contact when not needed, then we can all kind of contribute to addressing this crisis.
From mask shortages to hospital preparedness, many Texans have questions for nurses facing the COVID-19 outbreak. Investigator Aaron Cargile spoke with the director of practice for the Texas Nurses Association to get some answers.
We are continuing to get emails from different healthcare workers saying, my clinic is still not providing that personal protective gear for its staff. Are you hearing of a shortage? Is there enough to go around in Austin, in Texas? What should nurses do if they're not being provided that?
We do know there is a shortage, especially in areas that don't normally use protective equipment, such as clinics, long-term care facilities, home health. Our hospitals, for the most part, do have enough right now. I think that if we see the influx of patients that the other states have seen, our hospitals will also start to run out of personal protective equipment as well. The areas who don't normally use that, I'm hearing that they're waiting 6 to 10 weeks for their shipments to come in.
Wow. What should they do in the meantime?
In the meantime, as what they do have access to, the CDC guidelines do recommend that they reuse some of this personal protective equipment. And while that's not the ideal situation, if we don't conserve that equipment, then we're placed in a situation where we can't provide care because we don't have the equipment to use.
When it comes to masks, so we have been reporting on groups, companies, individuals in their home with their personal sewing machine making masks. While this sounds wonderful, are these masks actually usable and offering these healthcare workers the right protection?
There is no evidence to show that these masks are effective. And I know that the public wants to help in any way they can. There are large numbers of people in Facebook groups sewing masks and delivering them, and many facilities have actually turned them away and said that we can't use them. What I think we could use from the public now more than ever is to consider other creative alternatives to provide the equipment that we actually do need. So, for example, our schools are closed, and it's quite possible they might be closed for the rest of the year. We know chemistry labs have some degree of personal protective equipment in them, such as safety goggles and things like that. Can our public schools donate those to our hospital? We know that there are other industries out there who use personal protective equipment that may be closed for right now. What can they donate to our facilities?
My best friend is a nurse in a Dallas hospital. We spoke just a few days ago. She said things are slow right now, but the message we're being told is, brace yourselves. A surge could be coming. Is that still what healthcare professionals in Central Texas are thinking right now?
Absolutely, they are. I've talked to colleagues across the country who work in the state of Michigan and Louisiana who just 2 weeks ago were operating business as usual, just like we are to some degree now. And within the last week and a half, they have seen an increase in a huge surge in COVID-19 patients. As a city and in our surrounding areas, if we don't take the shelter in place seriously, it will only be a matter of time. We have to take the preventative measures and think of each other and our first responders and our healthcare workers and do the things that we need to do to protect everyone.
That was Erin Cargile reporting. A faith-based organization known for its disaster relief work is donating supplies to the coronavirus response in Texas. Texas Baptist Men delivered 10,000 N95 respirator masks, 2,000 hazmat suits, and 6 decontamination tents to the State Emergency Operations Center in Austin. This week, the state received donations from businesses, schools, and universities. The supplies will be distributed by state health and emergency management authorities as local leaders request them.